الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. This lecture is about postgraduate general epidemiology by Professor Mahmoud Hani Sulaiman. It contains different and many subjects relating to general epidemiology. What is meant by postgraduate? Those who ended their final exam at their faculty. Topics here mostly will not be addressed before final exam in any specialty. However, these information will be needed in any specialty after graduation. Because of why it will be needed? Because of change of place, geography, in many exams for license or evaluation for post, and for different job requirements. Take care, after graduation you can work in any place inside your country, for example inside Egypt or in any outside country, in the Gulf area, in Africa, in Asia, in United States, in Europe, in Latin America, in Australia, in any place. Specialties which may need this information includes, not all, but it includes general practitioner, primary health care, lab specialty, travel medicine, internal medicine, and its subspecialties, tropical medicine, infectious disease, obstetrics, gyna and its specialties, surgery and its specialties, pediatrics and its specialties, health administration, dentistry, nursing, pharmacy, veterinary work, occupational medicine and its specialties, preventive medicine and its specialties, and many other specialties. How to study postgraduate lessons? Have a quick look to know the subjects. Decide what places or jobs in which these subjects will be used. Write in a paper subjects, small paper, the subjects and the places and times you can use it. Put this paper in a special file, keep the file in your office, download the video and save it in your computer. Use it when needed. This is one of the subjects you are going to need it after graduation in any specialty. Disinfecting agents can be classified as follows. You can work in any place where you can use disinfecting agents. Natural agents like fresh air and sunlight. Physical agents, dry heat, like burning, hot, dry, air contact heat, ironing, moist heat, boiling, with or without chemical agent, steaming, current steam and steam under pressure, radiation, ionizing radiation, ultraviolet rays, chemical agents like solids, liquids, gases, and aerosols. Here is another subject. Includes levels of prevention. Levels of prevention, either primary prevention, secondary prevention, and tertiary prevention. For primary prevention, the appropriate response is health promotion, e.g. encourage healthy lifestyle changes, balanced nutrition and clean environment, specific protection, immunization, occupational and automobile safety. When the period in the natural history, this is applied pre-pathogenesis. So it is given, this is given and is done to those who are not diseased. Secondary prevention the appropriate response is early diagnosis and treatment. This is during the pathogenesis period. Tertiary prevention, disability limitation, e.g., institute medical or surgical treatment to limit damage from the disease. Rehabilitation, i.e., identify and teach methods to reduce physical and social disability, when this is done in the pathogenesis and post-pathogenesis area. Here is the prevention and control of an epidemic. It is the same methods used for sporadic cases, but on a wide scale. Why I put it here? Because as you have seen, any time there may be an epidemic or pandemic. So you must know how to make prevention and control for these diseases. And as you have seen, the plan for prevention and control of COVID-19 is taken by every specialty and every healthcare worker is included in the plan. And another remark is prevention and control is plan is formed of many measures. Each measure is important. Each measure alone is not enough, and all together they can prevent and control epidemic. Basic concept of control of an outbreak of disease is to break weakest link in chain of transmission of disease through three major steps: elimination of reservoir, breaking channel of transmission, protection of susceptible. Elimination of reservoir. Elimination of environmental reservoir as air, water, soil is unfeasible and out of question. Elimination of animal reservoir, keeping animals away from human habitation, is possible but difficult. For example, pigs in outbreak of Japanese encephalitis, cattle in brucellosis. Elimination of human reservoir, eliminated from acting as a source or reservoir of infection by following measures, i.e., infectious person is made non-infectious through the coming slides. Infectious person is made non-infectious by early diagnosis, notification, epidemiological investigation, isolation, disinfection, and treatment. First, early diagnosis. Earlier diagnosis is made and earlier treatment is started, so further transmission can be prevented. Delay in making diagnosis will lead to spread of disease. It is said that early diagnosis and prompt treatment of a case or carrier is killing the devil in his bed. وَأْدِ الْفِتْنَةِ فِي مَهْدِهَا. Also helps to know source of infection, so they are traced and treatment as in sexually transmitted disease, food poisoning, etc. Second, notification equal official report to local health authority, so they rush to spot and begin control measures early to prevent further spread. Epidemiological investigation. A detailed epidemiological investigation will be done in area to know distribution with reference to time, place, and person. These three are very important in epidemiology: time, place, and person. To know causative agent, source of infection, mode of transmission, factors influencing. To know magnitude of problem by estimating attack rate and case fatality rate. Isolation equal separation of sick persons from others in isolation ward of hospital for a period of time till he becomes non-infectious to prevent further transmission to others. This is physical isolation. Purpose: to contain disease, i.e., to assure disease remains confined to patient and it is not transmitted to others. This is of important value in highly infectious disease like diphtheria, pneumonic plague, SARS, pertussis, etc., where risk of transmission is very high. It is of limited value in diseases where large number of subclinical and carrier state occurs, as in typhoid, viral hepatitis A, meningitis, and so on. If isolation is of no value in control of disease like TB, leprosy, which carries social stigma, so it is replaced by chemical isolation. That is to say, giving domiciliary treatment. Isolation may be achieved by ring immunization, that is to say, encircling infected person or house with a barrier of immunized persons so disease does not spread. This was practiced to eradicate smallpox and now practiced in US to eradicate measles. Disinfection, concurrent disinfection, equal disinfection of body discharges as sputum, urine, and stools of patient. It is done as long as patient is in isolation ward. Terminal disinfection, disinfection of leftover articles of patient after death or discharge of patient. Treatment, done with objective of killing disease agent when it is still in reservoir. So infectious person becomes non-infectious. This is individual treatment. In high endemic areas, entire population given treatment with drug, irrespective of whether they have disease or not, as in malaria, filariasis. This is called mass treatment or treatment of entire family members, as in scabies. Quarantine, equal limitation of freedom of movement of healthy persons suspected to be exposed to a communicable disease for period, equals longest incubation period of disease. الحجر الصحي in international airport or seaport to prevent international spread of disease. That means those who were not having a valid certificate of vaccination were quarantined. It was practiced against smallpox, plague, cholera, yellow fever. That was called absolute quarantine. Modified quarantine or partial quarantine is selective limitation of freedom of movement, for example, exclusion of children from going to school during period of treatment, as in scabies, diphtheria, chickenpox, etc. Segregation means separation of a group of healthy but susceptible persons to protect them from getting a disease from infected persons, so controlling disease. For example, placing susceptible children in homes of immune persons. Breaking of channel of transmission. How it is done? Direct modes of transmission can be broken as follows. Contact transmission by avoiding close physical skin-to-skin contact with infectious cases. Droplet broken by advising reservoir suffering from respiratory disease to cover nose, mouth while coughing, laughing, sneezing, and talking. Soil-borne transmission prevented by using shoes while walking. Bite transmission prevented by being away from animals or bites. Transplacental transmission, perinatal or vertical transmission, broken either by giving treatment to mother during pregnancy, as in syphilis, or by terminating pregnancy, as in rubella. Prevention of parent to child transmission, PPT-CT, prevention of patient to child transmission in HIV positive pregnant mothers is done by giving zidovudine or nevirapine during pregnancy or with onset of labor pain respectively. Then a dose of nevirapine to newborn, efficacy is 40%. Indirect mode of transmission can be broken as follows. Vehicle route broken according to vehicle. Water chlorinated or superchlorination. Milk pasteurized. Blood screened. Fruits and vegetables disinfected. And doing food hygienic measures. Sanitary preparation of food. Vector route broken by control of vectors. Airborne transmission prevented by controlling air pollution, control of infected dust in hospital wards, and other measures as adequate ventilation. Fomites transmission prevented by disinfection of fomites. Contaminated hands and fingers transmission prevented by adopting personal hygiene, e.g. hand wash. Protection of susceptibles. Susceptible protected by two measures. One, specific measures as immunoprophylaxis or chemoprophylaxis. General measures as improvement in quality of life as good housing, better nutrition, environmental sanitation, and legislation of sanitary laws. This slide shows the needed vaccine. Till now, these vaccines are not developed, so they are needed. Why I put this slide? So when you are in any specialty and you are choosing a point to do research on it, you can do a research on development of any of these vaccines. So this is an area for research at any specialty. Viruses needed vaccines are herpes simplex, dengue fever, HIV, RSV, hepatitis C, cytomegalovirus, EBV, Epstein-Barr virus, West Nile, parainfluenza. Bacteria, syphilis, it is in red, syphilis and Lyme disease, because these two vaccines are not under development. The other vaccines are under development. So bacterial vaccines needed: syphilis, gonorrhea, E. coli, Lyme disease, trachomatis, Clostridia trachomatis, group A streptococci, oral streptococci, parasites like malaria, helminthes, and schistosomes. Now, this slide describes vaccines when used as immunotherapy, not for prevention of disease, used as immunotherapy. Why I put this? Because you can need these vaccines as immunotherapy in any specialty. Herpes virus infection, vaccine decrease rate of recurrence. Leprosy, BCG potentiates chemotherapy effects. It is a vaccine for tuberculosis, but used as immunotherapy for leprosy because it potentiates chemotherapy effects. Tuberculosis, a new vaccine made of mycobacteria vaccine potentiate effects of antibacterial agents even in patients resistant to therapy. Potentiates effects of antibacterial agents even in patients resistant to therapy. HIV vaccine, vaccination with killed HIV may alter Th1 to Th2 balance in favor of Th1 cells, which are more effective indicators of anti-HIV response. This slide shows immune globulin preparations made from human plasma. For each immune globulin preparation, the name, the abbreviation, the route of administration, and year licensed. As you see, the name, there is anthrax immune globulin, botulism intravenous immune globulin, cytomegalovirus immune globulin intravenous, hepatitis B immune globulin intravenous, immune globulin subcutaneous, rabies immune globulin, tetanus immune globulin, vaccinia immune globulin intravenous, varicella zoster immune globulin. Also, antitoxin preparations from animal sera other than humans are available in botulism and diphtheria. So, immune globulin preparations made from human plasma are anthrax, botulism, cytomegalovirus, hepatitis B immune globulin, and immune globulin, which are general, immune globulin subcutaneous. Immune globulin, there is a preparation intramuscular, preparation intravenous, preparation subcutaneous. Then rabies immune globulin, tetanus immune globulin, vaccinia immune globulin, varicella zoster immune globulin. For each of these, it will be given how to use them inside the lessons of each one of these diseases. But this slide puts all them together. This slide shows recommended child and adolescent immunization schedule for ages 18 years or younger in United States. As I said, you can work in any place, and this schedule is used in many countries. I put it because it contains all the childhood immunization. As you see, hepatitis B, the vaccines inside red rectangles are not obligatory in Egypt. So you see here the vaccines of hepatitis B, rotavirus, which is not obligatory in Egypt, DPT, obligatory, Haemophilus influenza, obligatory, pneumococcal, not obligatory, inactivated polio virus, one dose given only in Egypt, influenza either live attenuated or killed, not obligatory in Egypt, measles, mumps, rubella, MMR, obligatory, varicella, hepatitis A and meningococcal vaccines are not obligatory. Then human papillomavirus, not obligatory. Meningococcal B, it is now present, but till now it is not obligatory. Pneumococcal polysaccharide vaccine, not obligatory. These are the ages at which these are given, or given at primary series, or for catch up if the adult did not take it. Please print it and keep it in a special file to use it if you need. This is also the same catch-up immunization schedule for persons aged 4 months to 18 years who start late or who are more than 1 month behind. For United States also, it is used in many countries and it can be used. So print it and use it when you need. This slide and the coming 3 slides are recommended child and adolescent immunization schedule for ages 18 years or younger. Little note about each one of them. Also print them and put in a file. You may need to use them. Here, diphtheria, tetanus, pertussis, DPT, Haemophilus influenza type B, hepatitis A vaccination, hepatitis B vaccination, human papillomavirus, inactivated poliovirus vaccination, influenza vaccination, measles, mumps, rubella, MMR, meningococcal group ACWY, meningococcal serogroup B vaccination, which is recent, pneumococcal vaccination, rotavirus vaccination, tetanus diphtheria and pertussis vaccination, but for upper age, varicella vaccination. This table shows recommended child and adolescent immunization schedule by medical indication. The idea of this table is very good. The column on your left is the name of the vaccine: hepatitis B vaccine, rotavirus, DPT, pneumococcal, and so on. And the row at the top shows the different medical indication, either due to pregnancy, immunocompromised, excluding HIV infection, kidney failure, end-stage renal disease and hemodialysis, heart disease, chronic lung disease, CSF leaks or cochlear implants, asplenia and persistent complement component deficiency, chronic liver disease, diabetes. Take the end one, diabetes. You notice different colors. Each color indicates special circumstances, special condition where to use it. The yellow one is vaccination according to the routine is indicated. So in diabetes, most are as indicated routinely: hepatitis B, rotavirus, DPT, meningococcal. This color indicates additional doses may be given. This is inactivated poliovirus. Then, as routine, this color indicates precaution for live attenuated viral influenza vaccine, and so on. So if you have a child or adult with this disease, diabetes, you must consult this slide, this table, what to give and what not to give. And in other diseases, chronic liver disease, asplenia, and persistent complement deficiency, CSF leaks, cochlear implant, heart disease or chronic lung disease, and so on. So it is very important in almost all specialties. This table contains recommended adult immunization schedule by age group. The column in your left hand contains the vaccines, and the upper row contains the different ages from 19 21, from 22 26, from 27 to 49, from 50 to 64, more 65 and more years. For in any specialty, you can meet an adult with any age of this. Okay? So you must consult this table, what to give and what not to give. Those in yellow are recommended vaccination for adults who meet age requirement, and the violet recommended vaccination for adult with an additional risk factor. This is violet, and so on. The gray not recommended, and so on. So you must consult this table if you have a patient at any of these ages and you want to give a vaccine to him. Again, another table contains recommended adult immunization schedule by medical condition and other indications. Again, you consult it for or to vaccinate any of these patients. Storage of vaccines. We will talk about how to store vaccines at different levels of healthcare services. Sensitivity of vaccines to heat. All vaccines are sensitive to heat to some extent, but some are more sensitive than others. Commonly used EPI vaccine, expanded program of immunization. Commonly used EPI vaccines may be ranked according to their sensitivity to heat as given in the table. Most sensitive and the sensitivity degrees by this arrow. OPV is the most sensitive. Sensitivity to cold. Some vaccines are also sensitive to being too cold. For those vaccines, freezing or exposure to temperature less than 0 degrees centigrade can lead to loss of potency, and so vaccine will be useless. For these vaccines, it is essential to protect them from heat and from freezing. The vaccines sensitive to freezing as well as to heat are given in coming table. The most sensitive to cold is hepatitis B vaccine, and the arrow show the decreasing of this sensitivity. Sensitivity to light. Some vaccines are very sensitive to strong light, so must always be protected against sunlight or fluorescent neon light. BCG, measles, MMR, rubella vaccines are sensitive to light as well as to heat. These vaccines are supplied in vials made from dark brown glass, which gives them some protection against light damage. But care must still be taken to keep them covered and protected from strong light at all times maintained. All potency will be lost and vaccine be useless. This describes the walk-in cold rooms where the vaccines are put, deep freezer where the vaccines are put, small deep freezer, refrigerator, vaccine carriers, and day carrier. You can use them after ice packs, and what is quality of cold chain and vaccine stock management. Recommended conditions for storing vaccines are shown in coming table. This table indicates maximum times and temperature in each case. Each time some damage due to heat occurs, loss of potency accumulates, and eventually, if cold chain is not correctly done. This is the table. WHO recommended vaccine storage conditions of every vaccine on the left side and at different levels: primary level, intermediate, health center, health post, and the temperature needed is given. The coming slides will describe emergency which may happen due to immunization. These are the vaccine reactions which might happen due to vaccine. It is either localized reaction, psychological, and symptom of each, and how to manage it. Then the complete of psychological fright and syncope, how to manage it, anaphylaxis, and how to manage it. This is the emergency medical protocol for management of anaphylactic reactions in children and teens due to immunization. There is first line treatment and secondary line treatment. First line treatment for medical management is epinephrine, and here is the doses in different weights for infants and children and teens and how it is given. The second line treatment, diphenylhydramine, and the doses are given for in each case. وفي النهاية لا أجد إلا أن أقول الحمد لله الذي بنعمته تتم الصالحات و thank you.